Hi, my name is Dr. Gold C.W.E. Manuel, and Afropsychologist is my brand. I previously talked about psychosexual dysfunction and clarifies it from sexual dysfunction, where medical experts can readily give answers to such sexual dysfunction. I highlighted that psychosexual dysfunction is as a result of psychological factors which stand as impediment to one reaching a satisfactory sexual relationship. What I'm going to be doing today is to clarify the differences in perception about what normality is. What is the norm where sexual relationship is concerned? What I will point at this particular time is the differences in individual. People are different in terms of their perception, in terms of the ways they do things, particularly where psychology is concerned. They're different in terms of behavioral patterns. What is normal to someone could actually not be the norm with someone else, depending on the pathway that that person has taken to see or identify what they feel normal is within their own context. A person could feel like having a relationship, being with a partner, going through sexual arousal and reaching orgasm is the norm. Another person could feel that doing something completely different, or not reaching an orgasm but having that satisfaction within themselves, is what they class as the norm when it comes to sexual interaction with someone else or with their partner. Like I said before, psychosexual dysfunction is the inability of somebody to reach, or a person to reach, sexual satisfaction within oneself and with their partner. What psychosexual dysfunction is not is a situational factor. I know I've mentioned situational factor in a context where I mentioned that it has to do with maybe someone is anxious at a particular time, but I would also use situational factor to elucidate what I'm trying to say in terms of what psychosexual dysfunction isn't. It is not when you're not in the mood to have a sexual engagement with your partner. Say your husband comes in or your wife comes in, for example, and intend to have a sexual engagement with you, and you're not in the mood and you're not functioning properly as at that particular point in time. That is not psychosexual dysfunction. Psychosexual dysfunction is an actual dysfunction which is caused by psychological factor, or which is caused by psychological factors or by a psychological factor. Now I talked about the norm. What the norm is relative. A person would feel, for me, sexual satisfaction is about my engagement with a person of like mind, to engage in sexual activity to result in satisfaction in whichever means or whichever way that we both plan for it to happen. It could be the norm within that relationship. It could also be the norm within a different type of relationship, that a man and a woman engage in sexual activity, which then leads to orgasm for both of them, thereby ensuring satisfaction on both ends. So that is the norm for them. The norm is relative and people in different types of relationship can have sexual satisfaction in their own way. However, where dysfunction comes in is if you follow what your norm is and it's not happening. Satisfaction is not coming up, you're not engaging, you're not feeling your satisfaction and sexual satisfaction, and then it becomes a problem for you and you feel you need to speak to someone. It is important that in any kind of situation that you find yourself, if it's becoming a problem within you and you're having difficulty with that situation, it is important that you seek advice. Talk therapy, for example, does help. I did talk about a forum which I have on Facebook, which is called Psychitalk. Basically, it's just a forum where you talk about things. It helps you to heal repression. And repression is a factor. Evidence show that repression is a factor for psychological problems, psychological challenges. Not maybe at that particular time, but in future, it is a factor. Going by evidence that show that. So, in a normal relationship, in a normal sexual relationship, bearing in mind the relativity in the use of the term normal, when you're not able to do the normal thing that you do and attain sexual satisfaction, then there is psychosexual dysfunction. However, what it is not is situational instances where you're not in the mood, you don't want to have it, or you can't just be bothered to have it with your partner, then that isn't a dysfunction. It's a decision, a voluntary decision which you're making for yourself not to have a satisfactory sexual engagement with your partner. It is important that in any situation where there is psychosexual dysfunction, that you actually seek psychological intervention so as to help you through that process and therefore avert long-term problems that has to do with your sexuality. It is important also to embrace psychological intervention. And I mentioned the psychosocial cultural intervention, which I keep talking about. It's my intervention, psychosocial culture, because I come from a background that is culturally based, and everything we think about is religion. We talk about, everyone goes to church, everyone goes to, you have a multi-religious facets where you have the Muslims and the Christians and the traditionalists. That traditionalists are those people who have their method of worship, their deity, prior to the introduction of Christianity in Africa. So we've got that multicultural thing going on, and I sensed from that background that psychology could actually be applied in that sort of environment, particularly understanding the antecedents of the cultural, the way culture is established within that particular environment, and to introduce some sort of psychological intervention that matches the antecedent of what is already in that particular culture. So psychosocial cultural it's an intervention which could gradually introduce the importance, or not just gradually, we're not forcefully introducing it, we're gradually introducing the importance of psychological intervention in an environment that doesn't understand the importance of the works of psychologists. I keep imagining or thinking about this situation, people with genuine psychological problems or challenges are not getting the help that they need because there isn't that avenue for understanding the importance and the efficacy of the work of psychologists. So, if there is a medical explanation for sexual dysfunction, then in an environment that doesn't understand the importance of psychology, then there is no intervention for psychosexual dysfunction. It is Dr. Gold C.W.E. Manuel, Afropsychologist, remain my brand. Oh.